Unatazama Ndizi TV. Afrika.
Well, it is yet another Friday, and today is the day that we have our very important program, Afya Yetu Health Program. And welcome back to Afya Yetu. My name is Chemutai Kirui. I am your host for the show. And tonight, of course, we are going to talk about another thing that many people are really not aware of, something that is affecting a lot of people in Kenya and also in the globe. But many people do not really know or understand what they are going through, or maybe what their friend or their family member is going through. We are going to talk about a health condition, a mental health condition, that is bipolar disorder. It is a disorder and it's a condition. Of course, we cannot say it's a disease or something else, but we are just calling it a condition that is affecting a lot of people. And millions of people, according to research that has been done recently, millions of people in the globe are facing this bipolar disorder, and they are not really aware. They do not know what is really happening to them. They just think it's maybe just normal mood swings, or maybe a shift in energy and behavior. But it is something that we have to talk about it. It's something that is dominating, especially in the current generations. Many things, our lifestyle, of course, is also affecting these conditions and how these conditions come to our lives. Now, tonight, of course, we are joined by our mental health expert, Harriet Wambui of Oasis Mental Health Hospital, and she is going to unpack for us tonight what specifically is bipolar disorder, how it comes to us, and how we can be able to manage it. Daktari, karibu sana to Afya Yetu tonight.
Thank you.
So much. And maybe you can just introduce yourself, what you do, and maybe tell us plainly what bipolar disorder is.
Thank you. Hi, my name is Harriet Wambui Njoroge. I'm a psychologist, senior psychologist working with Oasis Specialist Mental and Rehabilitation Center. And we are here to unpack about bipolar. We want to make our people understand about mental health conditions. Bipolar is a condition that most people don't understand because we rarely talk about it. But today I believe that our audience are going to run and rerun the things that they hear about bipolar.
Thank you so much. Doctor, we are so privileged to have you here tonight because, in the recent 2 months, there have been a lot of especially two major incidences that hit the news. There was that guy, the foreign guy, who was insulting the police officers in Kwale, and also we lost Kimani Mbugua due to bipolar disorder. And now this is something that, of course, many people are not ready to talk about it. They just think it's something that is normal. But Daktari,
yes,
I think it is very important for people to know that it is something that is somehow it's normal, but then again it's a condition that you need to seek medical attention and medical help to maybe get out of it, and maybe to come back to your normal life. Now, to start us off, what exactly is bipolar disorder clinically or medically, and why is it often misunderstood by people?
Okay, bipolar mood disorder, I can say, is a mental health condition that is characterized by mood changes, extreme mood changes, behavior changes, and shift in energies. For example, mood changes, I mean that at times someone might seem depressed, at time they might seem overly joyful, happy. There is change in behavior. Sometimes they are violent, sometimes they are calm. Sometimes, they are very hyperactive, like their energy is up there. And another time they don't have energy, they don't even feel like waking up, getting out of bed. So bipolar is not about mood swings. It's something complex. I can say it's a mental health condition. It is a disease, like the way mtu huwa anapata malaria, the way someone gets depression, the way someone gets typhoid, the same way we get bipolar. So it is a mental health condition, and it is a disease like any other. The reason as to why most people, don't understand bipolar is because bi means two, meaning that there is changes, there is mood changes.
You can be in two extreme changes, like it's so drastic.
Yes. So you find that someone is hyperactive, and at times they are depressed. So we'll be like, but this person was just happy. There is an episode in bipolar called hypomania, where you are behaving like the behavior is just a little bit extreme. It's just a little bit extreme.
It's just beyond too much.
Yeah, it is not too much. So people might think that it's just that Harriet have a lot of energy. So people misunderstand, and they think that it is normal, of which it is normal. It is not normal. It is a condition. That's why it is usually misunderstood, because there is shift in moods. So sometimes they are depressed, sometimes they are hyperactive. So it becomes difficult to understand. Yesterday they were happy, today they look depressed. Their mood is sad. What is happening? Yes.
And just staying there in the bipolar and the mood shifts, clinically, how can we be able to differentiate when your mood is just normal and then now when the bipolar disorder starts kicking in? Because sometimes it's very normal for us, because even me as a person, using myself now, sometimes I just feel I do not have the energy to even maybe wake up to take a shower. And then there is a time where I just want to do everything. Suddenly I have the energy to cook, I have the energy to clean, I have the energy to go out and meet people. But sometimes I just want to stay in my bed. I don't want even to wake up to maybe go outside and take some fresh air. How can we medically differentiate that?
Okay, for what I can say, for bipolar, you must have this. When someone experiences these symptoms, they experience them for few days to 2 weeks. What we go through every day, maybe it happens once maybe in a blue moon, once in a month, once in a week. But when someone have bipolar, they experience the symptoms for a week, even days, for most of the days in a week, or even for a period of 2 weeks, they might experience the symptoms. And
the shift in change.
Yeah, the shift in change. It's not something that happens in a day or in an hour. No, it's something that happens for several days, even weeks. Yes, and as we said, bipolar is characterized by actually 3 episodes. The first episode is called manic episode. So we have 2 different types of bipolar. We have bipolar 1 and bipolar 2. Bipolar 1 ni yenye mostly someone has manic episode, but they may still have depression. But what dominates bipolar 1 is manic episode. Manic episode meaning that I have a lot of energy. I cannot settle. Siwezi tulia mahali pamoja. I am restless. I'm up and down. There is behavior changes. I might get abusive. I might get aggressive. There is also changes in sleep. Like I'm hyperactive. I don't need sleep. Like I have reduced need for sleep.
So you just have a lot of energy.
Yeah,
to do
you have
things.
a lot of energy to do
You're
things.
just restless, maybe.
Yeah, you're just restless. And at times they are, I can say they are reckless in spending. Like if I have earned, it is end month, I can use all the money without, thinking about the consequences.
Okay.
Yeah,
That's
if I use this,
so dangerous.
Yes, what will happen next week? So like when someone is in that manic episode, like they don't think about the consequences. Okay. Yes, and you might find others are varga meaning that they are just abusive. They can talk anything because they are not in the their right sense. So like every behavior is on extreme.
Yeah.
Yeah, it is on extreme. Then the other episode is hypomania. Hypomania is just like mania, but now less extreme. Like it's almost normal, but not normal.
Okay.
Yes.
Yeah.
So if I have energy, it's ni energy juu kidogo ya yenye nakuanga nayo. If I am less stressed, ni less stress juu kidogo ya how I am usually. So it's very difficult for my friends, for family members to know that, you know, there is shift, because it's almost the same me but imeongezeka kidogo.
But now this should be persistent, like it should should be happening in maybe within 2 weeks to even a month, and then now we should be saying that this one is.
Yeah. So the difference is that I might experience this for days, for weeks, but you know, sasa ile ya kawaida I'm experience it maybe just a day.
Yeah.
Yes. Then now there is depressive episode. Depressive episode is where someone experiences depression symptoms. So bipolar 2, someone experiences major depression and hypomania yenye sasa mania yenye haijaenda sana. Yes. So, but for us to know that someone have bipolar, for the psychiatrist to diagnose that someone have bipolar 2, they must experience the major depression. The major depression meaning that they are experiencing, you know, most of the time they are sad for more than a week. You know, for 2 weeks. For us to say someone have depression, they must have experienced at least these 5 symptoms for 2 weeks. For example, most of the times they are sad.
Yeah.
So in those 2 weeks, half of the days they are extremely sad.
Just sad. Maybe
Yes,
not even
sad.
moving, not even speaking to people.
Yeah. They want to stay alone. You know, they are isolating themselves. You know, they cannot sleep. It's either they are not sleeping, or they are sleeping too much. They don't have appetite, or they are not eating, or they are eating a lot. So there are those people who, when they are stressed, they eat a lot.
Yeah,
and there are those who don't eat. Then there is now having suicidal thoughts or attempts, you know, to die by suicide.
Yeah. And
they cannot concentrate maybe at work. So bipolar is characterized by those three episodes: mania, hypomania, and depression. Yeah. That's why it's very, you know, it's very difficult for the common person to differentiate and know that this person is not their normal self. Yes.
Okay. So it is very wrong for people to, maybe when someone is undergoing this bipolar disorder and maybe they are in their depressive stage, it's very wrong for people to just think that maybe it was bipolar and then now it has come to the ordinary depression. But now, Daktari, how can we be able to compare or maybe to differentiate between just ordinary depression and now the depressive stage of bipolar disorder?
Okay, thank you, Chemutai. Okay, what happens with the ordinary depression and the depression of bipolar? Actually, there is no difference. The same symptoms that someone who have depression is going through is the same symptoms that this person who have bipolar, when they are in that episode, they are going through. Yes.
Okay. And is there a difference in how women who are bipolar and men who are bipolar, is there a difference of how they behave or maybe how they go through all these stages from the first stage to the depressive stage?
Okay. Thank you, Chemutai. You realize that, you know, the difference between men who have bipolar and women who have bipolar is that for women, you know, they might engage in risky behaviors. Yes, a lot of risky behaviors. You know, a woman walking there, they are not in their right sense, they are walking there at night. Yes. So they engage in a lot of risky behaviors.
But especially now, considering that women, of course, when they are stressed, we can say that most of their hormones are maybe too high or too low. So can hormonal changes also affect how bipolar disorder comes out in women?
Not really. Yeah, hormones does not play a role.
Okay.
Yeah.
Okay, thank you so much. And now, how about societal roles and stress? Maybe just how men handle stress and maybe how women handle stress. Will it also be different when it comes to bipolar disorder in women and also in men?
Yeah, because for women, you know, when they have an issue, they tend to express it. When they have an issue, they share. But for men, our culture has brought our men in a way that they don't want, you know, to express themselves. By the time mtu anafika hospitalini is when, you know,
Things are worse.
Things are worse.
Way worse. Yeah.
Yes, so for women, at least many women, when they have, it's easy to diagnose bipolar in women because women have health-seeking behavior, unlike men who comes to the hospital when things are worse. And for women, it's easy to manage since they easily open up. For a man, it's difficult to open up, but when they open up, they get helped. Since bipolar is managed through medications and psychotherapy. Psychotherapy meaning counseling. Yes.
And first, Bigo, there is a time whereby I want us to talk about the things that mostly trigger the first two stages, the biggest stages for maniac and depressive episodes of bipolar. But before we go into those ones, can we differentiate maybe the signs and the symptoms for each of these stages? Are they procedural or something that just come anyhow?
Okay, they are not procedural. Like if I have bipolar, I might have manic episode, and there are those who might experience the depressive episode.
So it's not like, it's not possible for one person to have all the three episodes.
Yeah, no. Okay. It's not possible for one to have all the three episodes at once. So what happens if I have manic episode? I have been admitted in a hospital. I have given medications. You know, with time, you know, the symptoms zinaenda zikireduce up to a point where now I become my normal self. Yes, so venye tulisema with the common most type of bipolar, which is bipolar 2. So the most common is what most people experience is the depressive episode and the hypomanic episode, which is not extreme. Like if I have mood changes, they are not to the extreme. Yes, so sometimes I might, so there are those people who will experience the depressive episode, and there are those who will experience the manic episode. Yes, so it is not procedure.
Okay, thank you so much, Daktari, for clarifying that. And now, in your experience as a psychologist, what do you think are the biggest triggers for the manic episodes and for the depressive episodes of bipolar?
Okay, thank you for the question, Chemutai. So for bipolar, what I can say that we have risk factors to bipolar, like any other mental health condition. Yeah. For example, we have substance use. Substance use can trigger someone to have bipolar mood disorder. So it is a risk factor for bipolar mood disorder and other mental health conditions. There is genetics, biological, meaning that if there was a history of mental health issues in my family, there is a likelihood that someone in the family might get, but it is not 100% that if I'm able to manage my stress well, if I don't do something that will trigger, for example, using substance use, the bipolar in me will itabaki ni kama itabaki
it will be suppressed.
Yeah, itabaki haita surface as long as I don't do something that will trigger it. Like I don't engage in substance use and I know how to manage my stress. So it does not mean because maybe in my family my dad had bipolar that I'll automatically get it. Yes. Then there is neurochemical imbalance in the brain. The hormones in the brain, you know, the chemicals in the brains, when they are not balanced, someone might get bipolar mood disorder. So we can't say that bipolar mood disorder is caused by one factor. It is a combination of different factors. Yes, it is a combination of different factors that causes bipolar. It is not just one single factor that we can say causes mental health issues.
Okay.
Yeah.
And Daktari, earlier we mentioned about lifestyle, and now you just mentioned about the brain chemicals and the brain hormones. Is it possible that whatever we feed on, maybe the processed foods, because the urban people mostly depend on processed food, or maybe foods from the greenhouses, GMO products, these are things that we know, of course, they affect our hormones, they affect the way our brains function and our body functions. Is it possible that also these products can cause bipolar disorders, or maybe can become a trigger to the bipolar disorder that was suppressed to be triggered now?
Okay, not necessarily that the food we eat can trigger bipolar mood disorder. The neurochemicals that I'm talking about are the chemicals in our brain. For example, the dopamine, the serotonin, that is the cortisol hormones. So these are not, they are something that is biological, that we are created with. So it is not affected by so what I can say is that bipolar is not affected by it is not contributed by the food we eat,
or even the medicines.
Yeah. But what happens is that, for example, dopamine is a happy mood. I'm a happy feeling. We call it a happy hormone. So the food that I eat, if I eat sweet food, it might trigger dopamine to be overproduced, and I will become happy. But it does not necessarily, contribute to someone having bipolar.
Thank you so much, Dr. for clarifying all those triggers, especially the big triggers for the manic and the depressive moods. And now there is often resistance to medication. Why is medication adherence so crucial for stabilizing bipolar disorder among people?
Okay, thank you. We say that mental health issues are chronic condition, meaning that I have to live with them for a long period of time. Just like the way someone who have pressure, have diabetes, they have to take their medication for a long period of time to stabilize their sugars, to stabilize their blood pressure. The same, someone who have bipolar, have mental health issues, they have to take their medications. Remember, we said that there is imbalance in the brain. So these medications are helping, create that balance. Yes, and if we don't take these medications, there is always going to be relapse. So medications are very important, and we always encourage the patient and their families that they should not stop medication unless the psychiatrist have told them otherwise. Yes. So medications are very important.
Okay.
Yeah.
Thank you so much, Daktari. To our viewers, remember you are watching Afya Yetu. My name is Chemutai Kirui, and with me here is a psychologist, Afya Yetu from Oasis Mental Health and Rehabilitation Center. We are talking about bipolar disorder tonight, and this is something, of course, that we mentioned earlier. Many people are not really keen to maybe to know what they are going through. They just think that it's normal mood changes, and it's it's just going to go when the stress is over, or maybe when the climate has changed, because normally we blame all these mood changes on the climate, stress, and maybe just the environment that is surrounding us, maybe work environment. Maybe for sometimes you are having a lot of work, and then maybe there is just less work, and these things can come, and you might ignore them when you really needed to be keen on your body and be keen on what you are going through, and maybe seek medical assistance. Now we are taking a commercial break, and when we come back, of course, we are going to discuss how bipolar disorders can be managed, how it is able to affect our relationships with our family members, our work colleagues, and also everyone else in the community. Because Daktari, of course, we must admit that someone who has a bipolar disorder, they are just not going to live a normal life, right?
Okay, someone who have bipolar mood disorder, as long as they take their medications, the condition is manageable. You can work. We have those people, those patients who are working, and bora too they take their medications, they thrive in their workplaces.
Yes, of course, that is one secret to managing bipolar disorder. But when we come back from the break, we are going to discuss that one and more about managing bipolar disorder. I am Chemutai Kirui, and Afya Yetu Health Show is taking a commercial break. We'll be back shortly.